Hi guys, and good morning. It's Shimona Clark, family nurse practitioner for Clark Nelson and Associates, and I'm here with another cup of the morning coffee. Now, people always ask me, what kind of coffee am I drinking, or what am I drinking in my coffee cup? Today is a tea for respiratory and immune health, and just kind of trying to prepare for this upcoming flu, cold, pneumonia, and COVID season. So this tea has slippery elm and some oregano, a little shot of colloidal silver, and of course natural vitamin C. So let's get started. Today's topic is glucagon. This was actually a request from someone who had watched one of the previous morning coffees, and they wanted me to address glucagon. So what is glucagon? Well, glucagon is a hormone that is released by your pancreas into your bloodstream to prevent you from having low blood sugar. So, in a person that does not have type 1 diabetes, this happens naturally. It just is a naturally occurring thing. However, for our type 1 diabetics, this does not happen. So they must seek an outside source of glucagon or fast-acting sugar. So, I'm going to show you today how to mix a glucagon kit. I didn't actually have the actual kit because generally you want to make sure that you dispose of those sharps and the glass vial pretty much immediately. But what I do have is a picture of what it should look like. So here we see there's going to be the syringe here, and this is what you would call a pre-filled syringe. So it's got 1 milliliter of saline in here. And then you've got your vial. So the vial is going to contain the actual glucagon mixture that needs to be reconstituted or mixed with the saline. So this will be powder in the vial, and this will be the saline. Now, a lot of teachers, you guys get a lot of kids, because obviously type 1 diabetes affects children more. That's when it's pretty much diagnosed. So you guys are going to see this a lot. So that's also why I thought this might be a good video to share. So although I don't have the glucagon kit, what I do have is a vial and a syringe. So let's get started. As I stated, your vial that's going to come into your kit is going to have powder in it. So you should be able to, it just looks a little dusty inside of the kit. Or inside of the vial, excuse me, and that's fine. Now, for the syringe, you want to make sure everything is intact, meaning the needle is here under this plastic cover. You're going to have the actual chamber where the fluid is going to be. You want to make sure this is not cloudy or anything like that. No cracks in the barrel here, and that your plunger works. So this is called a plunger. Now, if you have a pre-filled glucagon kit, it should come with approximately 1 milliliter or cc for those of you in healthcare. And I'm not certain if you guys can see, but hopefully you can. It has 0.5, then 1 is where the black plunger is at, and then 1.5. So we're basically in the middle there. Now, we want to ensure that we have 1 milliliter of saline in here because that's how much it takes to activate this glucagon. And that's what we're going to need to inject. Now, let me stop here because I want to explain something to you and just give you just a little tidbit. For those of you who would be injecting a child, just think of it as a child is about half your size, so you want to give them half of the glucagon. So, and when I say child, I mean 6 and above. So a 5-year-old or anybody below 6, you're going to give them half. But 6 and above, unless they're real small 6-year-old, you want to inject them with, if you have been educated on this, you want to make sure that you're injecting the full 1 milliliter. So, again, you're going to start with your vial. Vials will come, and you don't want to use a vial that does not have a lid on it, like mine, but I've done this millions of times, and I use this same vial for other things. But for your glucagon, if the seal is broken, that's what that lid on there means. You don't want to use something where the seal is broken, because then you don't know what this vial contains. So you're going to pop off the lid to the vial. You're going to take your 1 cc or 1 milliliter of saline in this syringe. Now, I'll take my little plastic cap off and I'm going to lay it down. So generally, I would say make sure that you use a flat surface here. Let me put this down just a little bit so you guys can see here. And I like to use my flat surface and inject the vial this way. And then I'm going to push the plunger down, making sure that all of the saline from the plunger ends up in the vial. Then I'm going to remove the vial, and see, I still have the I have the syringe, and now all the fluid is here in the vial. Now, what I want to do with the needle to prevent myself from being stuck, so you're gonna actually take the needle. Ooh, my little cap rolled away. That's fine. And just kind of stick the end of it here inside of your plastic. You don't have to click it on there, but just to prevent any sticks. Kind of put the little beveled end of the needle inside of the cap. Now I'm going to take this, and of course in real time, you're not going to be taking this long, but I'm talking to you guys and spending a little time with you. So, and we just want to roll this back and forth. One, we want to get a little bit of the heat to kind of help mix this and make sure that the saline is mixing well with or reconstituting our powder. Something to look for is when you look, can you see how this is like a water-like substance? You want it to look like this. You shouldn't see chunks of powder in here. It shouldn't be cloudy, shouldn't be any of that. So now it doesn't matter how much or once you put the 1 cc in, because you're going to want to take out that 1 milliliter or 1 cc. That's the same thing. So after I've rolled this just a few times back and forth, made sure that it is reconstituted or mixed appropriately, you can just swirl this around just a little bit and see, okay, it's the right consistency. So now I'm going to sit this back down again to prevent from poking myself or someone else. Now, this time, you're not going to inject anything. You are withdrawing or taking out. So your black plunger should be all the way up to the edge of the needle, right? So we're going to, again, do this. And I like to invert my bottle and withdraw. If you can see this, 1 cc. I'm going to pull the needle out. Now I have 1 cc. And then on whatever patient you are working with, person out in the community or whoever, a good place to go is the thigh. You know, that's a big muscle, so you can get that in the thigh. You can get that in the buttocks. Those are the best places to inject. And then, of course, you want to inject, insert the needle, push the plunger down, so that way you can get all of the fluid. You want all of the fluid out of here. Ooh, I'm dripping a little bit on myself. Get all of the fluid out of here. And then you're going to take the needle out and take your finger. I like a finger, but you could do a hand. Put a little pressure there. You want to hold that. Again, an IM injection, which is what this is. The needle's a little bit big and the fluid may start coming back out. So you want to put a little pressure to hold all of that glucagon, that sugar in there. Because again, this person is going to be unresponsive or unconscious. So they can't do it for themselves. So this is where you come in. You're the help. So put your hand there, hold it there just for a couple of minutes. And usually within 5, sometimes up to 20 minutes, they'll start coming back around, waking up, which is obviously that's the goal here. So as they start coming back around, waking up, you want to make sure that they get some sort of a snack. If they're coherent enough to swallow, then you want to provide them with juice. And then eventually a small meal, a snack, carbs, proteins, things like that. So I know some of the patients, they like cookies, The main one that most people know about is juice, orange juice. That's fine. We're not worried about the blood sugar going up at this point because we are just trying to get it up high enough to where they have come back and regained their consciousness or the seizure has stopped. So you want to ensure that you are, again, making sure that you are looking at your vial. There should be no cracks, no damage to the vial, no damage to the syringe, the chamber. The needle should not be broken. Also, another tidbit that I like to say, especially for teachers, but really this is anybody who has an unresponsive or unconscious person that they're working with. You want to put that person in like a recovery position. So what that means is you're going to lay them to their left side and kind of have, their arms, but it really just get them to the left side. I don't want to make this too complicated for you. What that does give you access to this thigh or to the buttocks. And also if they start coming to and they start throwing up or coughing, choking, any of those things, it's easier for whatever's in the mouth to just kind of start coming out. And that way they're not aspirating or choking or swallowing it down where it shouldn't be in the body. Okay, so let me push the camera back up. And that's a wrap for today's morning coffee. Thank you. Bye.